Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Tests that have to be performed before RFA treatment, that is before radiofrequency ablation for the treatment of fibroids. The first and foremost test, it can be RFA, it can be UAE, it can be myomectomy, it can be myolysis, it can be hysterectomy. The first and foremost golden standard is pelvic USG. You have to perform a pelvic ultrasonography. Apart from that, to get a clearer view, you should be doing your MRI. And then a common test that is for every sort of surgery is CBC, which is complete blood count, where we will be knowing if you have any sort of iron deficiency anemia, if you're having any sort of, infections running in your body, wherein the neutrophils are risen, your lymphocytes are risen, or any allergic reactions where your eosinophils are risen. We will be knowing all of that through the CBC. Along with that, ESR is also should be done, which is erythrocyte sedimentation rate. It increases usually in infection. If you're having any sort of infection, if you're having even pelvic inflammatory disease also, ESR can be increased. So by increased ESR, which means it is a contradiction for RFA. Apart from that, we have beta HCG, which is to confirm pregnancy. If you're right now pregnant, RFA cannot be performed. It is a contradictory factor. Apart from the tests, we have other regular tests also. First one is coagulation profile. As we have discussed, if we have any sort of coagulation bleeding disorders as such, or clotting disorders, it will be very hard to control the blood. So in order to know if you are having any bleeding disorders or not, we can get INR profile done or coagulation profile done. Apart from this, we need to do a pap smear if you are suspecting cervical malignancy. For example, if there is bleeding during intercourse, or by touching the cervix itself during examination, during bimanual examination, there is severe bleeding, then they will be doing a pap smear. As you can see here, pap smear will help you know if you have any sort of cervical malignancy. So this is the instrument that is used, and this is the brush that is used. They brush out the cervical cells and they send it to the lab to see if you are suffering from any sort of malignancy. Because if you're positive for malignancy or if they're suspecting malignancy, RFA treatment cannot be performed. And then urine analysis to know if you have any sort of urinary tract infections. And apart from that, remember fibroids are usually because of hormonal imbalance. So to know how your hormones are working, we need a hormonal profile also. These are some of the tests that need to be done before radiofrequency ablation. If you're someone who's suffering from fibroids or endometriosis or adenomyosis or polycystic ovaries or dysmenorrhea or PID, remember that Fidicus Homeopathy is the best way to cure all of this. We have two types of consultations here at Fidicus Homeopathy. One is the online option and second is the offline or the in-person option. If you're someone who's staying near the nearest branch of Fidicus, you can come and contact us in person. If you're someone who's seeing this video and are far away from us, you can contact us online through audio consultation options or through video consultation options. Once the procedure is done and once the case is taken, we will be asking you for investigations, and any sort of already done investigations can be shared with us. After the whole procedure is done, especially to our online clients, we will be delivering you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from female reproductive organ diseases, it can be fibroids, endometriosis, adenomyosis, PID, dysmenorrhea, polycystic ovaries, remember that Fidicus Homeopathy is the best way to choose your cure, because Fidicus Homeopathy stands for highest chance of health. Here we surely follow 3 principles. The first one is having highest success rate in already treating the existing disorders related to the female reproductive system. We have good number of cases where the outcome is very good and the recurrence rate has decreased. And also we have transparent treatment principle, wherein there is no gray area between the patient and the doctor. We will be discussing it with you about the prognosis of the case. And third is the personal care here at Fidicus is top notch. If you have any sort of misunderstandings or queries related to your problem, they will all be clarified. If you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.